Hi, everyone. This is Romani, and welcome to the fourth episode of the Medeavors video podcast. Today, I'm here with a phenomenal physician. This is Dr. Rani Banik, and she is a board-certified ophthalmologist, and she's also fellowship trained in neuro-ophthalmology, along with additional training in functional medicine. Dr. Rani practices in New York City, so there's a pretty big time difference. I'd like to thank her for making time that works for the both of us. Hi, welcome on the show. It's really nice to have you.
Thank you so much, Romani. Thanks for having me, and thanks for putting this together. I'm sure your podcast helps so many people. So it's a wonderful project that you have.
Thank you so much. So I'd like to start with the basic question, of course. Could you start off by describing your specialty and what your day-to-day practice looks like?
Sure. So first and foremost, I'm an ophthalmologist. So I did a residency in ophthalmology. So I do both medical and surgical care of the eye. And so I see a lot of patients with various kinds of eye conditions: blurry vision, dry eye, glaucoma, cataract, macular degeneration. Then on top of that, I did additional training in neuro-ophthalmology. So that has to do with all the connections between the brain and the eye. So it's really a combination of two fields. So I deal with a lot of patients who have vision loss from neurologic problems, whether it be stroke or trauma, concussion, or tumors, multiple sclerosis. I also deal with patients with migraine. That's a big part of my practice because many migraine patients have eye issues. And I also deal with unexplained vision loss. So when other doctors don't really know what's causing the vision loss, they usually refer the patients to see me. And then on top of that, more recently, I've gotten certification training in functional medicine. Many people may not know yet what functional medicine is, but it's a way to consider promoting health through addressing the root cause, not just kind of treating it on the surface with a medication or a surgery, but to get to the root cause and address it that way. And the basis of functional medicine is really healthy nutrition and lifestyle choices. So it's really treating the root cause, but also prevention is really key. So I apply that to eye health in terms of how we can promote our eye health for the future, for the decades we have ahead in our lives, how we can maintain healthy vision through eating the right foods and choosing the right lifestyle choices.
That's very interesting. So I'm sure over the course of your many years of training, you've heard being a doctor takes a lot of effort, it takes a lot of time. So could you address that by sort of talking about what your journey was like and what the duration of your education and your training looked like?
It definitely is a long road. It's not something that is quick and simple that happens overnight, but it's very rewarding. So my journey after high school in the US, I applied for a medical program that was 8 years long. So it was 4 years of undergraduate. So you get your bachelor's and then 4 years of medical school. I went to Brown University and they had a very kind of a very unique forward-thinking medical program where they integrated undergraduate and medical school years together. So it was really, I was so fortunate to be accepted to that program here in the United States. And basically that allowed me to pursue other areas of study, not just sciences, not just biology and human physiology, et cetera, but I could really pursue other things. I ended up doing an undergraduate degree in South Asian studies. So I studied the history, the culture, the language, the music, the arts. So it was really wonderful that I got to do that and then still go to medical school. And so after medical school, after my 4 years of medical school, then I chose ophthalmology, and fortunately I got into an ophthalmology program. It is quite competitive to get into ophthalmology in the US, but it requires 1 year of internship followed by 3 years of residency. So 1 year of just kind of a general medical internship is what I did. Other people may choose surgery, they may choose a transitional year in which they rotate through various different specialties. But then once you start your ophthalmology training, it really is focused just on the eyes. And you, in those 3 years, you learn basically everything. You learn how to take care of things medically, and then also all the surgeries that we do. So it's really, really a lot of information packed in. After that, I did a fellowship in neuro-ophthalmology. That was an extra 1 year of fellowship training. And during that year, I did quite a bit of research. And then after that, I became faculty and then, had various positions over the years, but it is a long road. So I would say it took me from graduating high school, it was 13 years of training after high school.
But seeing how you're working so well now, I'm sure it's all worth it at the end of the day.
It is very worth it. I mean, again, it's a long road when you're in it, but it's enjoyable. You're intellectually challenged. It's very rewarding. And then to be able to take care of patients and really impact people's lives it's a wonderful profession to be in.
Definitely. So next is what led you to pick ophthalmology as your specialty?
So because it was a combined program that I was in undergrad, I didn't know what I wanted to do. I had no idea what specialty I wanted to do. My father is an emergency physician, so he takes care of a lot of emergencies. He wanted me to follow in his footsteps and be an emergency medicine doctor, but it really didn't interest me that much. So what I started to do is I started to shadow lots of doctors. In my senior year of college. So I shadowed, for example, a pediatrician, a primary care doctor, a couple of other physicians. And then one of my family friends was actually doing his ophthalmology residency. So when he found out that I was shadowing people, he said, "Oh, why don't you come spend the day with me and find out what I do?" And I said, "Sure." I didn't really know anything about eyes, but when I went with him, it was probably one of the most influential days of my life because it really opened my eyes, pun intended, to the beautiful world of ophthalmology. And the eye is such an intricate structure. We take vision for granted, and to be able to help someone with their vision, to be able to restore someone's vision with a surgery like a cataract surgery, is just so impactful, both for the patient and the doctor. So I really became interested in that, and then I did other things along the way to really solidify my interest. I did research at the NIH. I just kind of shadowed other doctors. And then even during medical school, I kept my options open. I said, okay, I'm interested in ophthalmology, but I'm still not 100% sure. I was also interested in neurology. And actually it turned out, to be a good thing, because later on I did a fellowship in neuro-ophthalmology, so I was still able to combine those two fields. But I would say, it's a process. It's not like you just know like that. It's kind of experiencing, being exposed to different things and figuring out, where your interests lie and what you feel most comfortable with.
Great. That sure serves as great advice. So this next question kind of ties in with that, but what are some factors that a student should consider when they're picking their specialty?
I would say probably lifestyle is very important. Like, what type of lifestyle do you want to have? For example, if you choose certain surgical subspecialties, like I'll choose, for example, trauma surgery. It's a really intense a job, and basically, you're on call. You can, you may be on call like every third night, every second night, every fourth night, depending on where you are, and that really puts a strain on you physically, but also, it may limit your family life in terms of not being able to spend as much time with family. So it really depends on what you're looking for and what you're interested. For me, I loved ophthalmology because there are emergencies, but not that many. And most of our days are, in the clinic as an outpatient. And then we also get to do surgery. So there's a nice mix of treating people medically, but also doing surgery. It's very technical. We use a lot of instruments, so I get to use my hands, very skill set oriented. And also you get to build long-term relationships with people versus other fields. Like, for example, my father, who is an emergency room physician, he sees patients once in the emergency room and he may never see them again. So he doesn't really know the outcome, but, and then he doesn't get to develop like long-term relationships with his patients. But for ophthalmology, I mean, I can start seeing someone when they're a child and see someone through their whole adolescence into their young adult life. And sometimes I see families, families come to me. I see the parents, the grandparents, the children. So it really helps you develop relationships with your patients.
I understand that whole idea of getting families to come. For example, in my family, everyone goes to the same doctor for the eyes. So they say it's like I'm kind of building a bond with your entire family.
Exactly. It's a relationship, and it's a long-term relationship, and you trust your doctor. I think that's very important. People have to feel comfortable and trust their doctor. So
Definitely. So this is an interesting question. What is one specialty that you did not consider getting into, like it was completely off your radar?
that's a tough question. I enjoyed most of my rotations in medical school, but I think the one rotation I really did not enjoy for whatever reason was OBGYN. It just was not appealing to me, delivering babies, even though it's such a miracle, it's such a wonderful thing. It was not for me. So it's a personal choice, really.
It's very ironic you say that. You're my fourth interview. All three I've spoken to before have been OBGYNs. So
Oh, they have been OBGYNs.
yeah, so it's interesting knowing that. Nice. I get some variety into my responses. So of course, there's a lot of stress surrounding the various exams that come with being a doctor, whether that's the MCAT to apply for medical school or the step one when you're preparing to get your license. So what are some tips you would share for students who are preparing for any exam that's competitive and that's for med school or for being a doctor in general?
So I was very fortunate in that in my program at Brown, we did not have to take the MCAT. So as long as we maintained a certain grade point average, we were able to stay in the program. So I never had to study for something like that, but I did have a lot of friends who went through that process. What I would say is you have to pace yourself for this exam or any exam, kind of like when you're starting, like lay it out. Okay, I need to cover this amount of material and chunk it out and do a little bit every day. This is very, very important to get into a routine where you're doing a little bit every day. So, it's not the case where right before the exam, you're cramming, you're like, oh my goodness, I still have to finish all this, material. It shouldn't be that way because that causes a lot of stress. So lay it out. The other thing is to really seek out help. So whether it's taking a course, having a tutor, it's really, really important. You don't need to necessarily do this on your own. It's been done before. There are strategies, there are techniques that other people can help you. So reach out and find the help and resources that you need.
That's great advice. So the next is you talked a lot about when you were deciding about your specialty, the importance of research and shadowing. So could you just build upon that a little more? How important is it to do both those things?
I think shadowing is very, very important. Now, during medical school, you do get an opportunity to not just shadow, but to go through different rotations. So yes, you're exposed to medicine, surgery, pediatrics, OBGYN, psychiatry. Those are the main ones that people are exposed to. But I think it's also important to see what it's like to be a practicing doctor, basically, excuse me, a day in the life kind of experience, like to shadow someone to see, okay, this is what it's like to go to the office. This is what it's like to go to the operating room. This is what it's like to do the administrative work, the charts or the meetings. And that way you can really get a sense of the pace of the day, the types of patients that come. Yes, again, you get this if you do in medical school, if you do the rotations, you get some amount of this, but most of it's hospital based, not as much outpatient based. So I think it's important to shadow. And then research, it does help certain specialties. It really is important to do research, to be, especially the more competitive specialties, to have that on your CV, your resume. But it really just all depends. And then there's the question of whether you do clinical research or basic science research. And it really, again, is dependent on, your interests and your what's available to you. Like you may live in a place where you don't have access to doing research or basic science research. So it's really individual in terms of, how you prepare for medical school ahead.
Great. So I hate that I have to ask this question, but we are especially here in the midst of a third wave of the pandemic. So how has COVID-19 affected your practice and how you go about your day as a physician?
So in the beginning, it was very disruptive, unfortunately, because I live in New York City and we were hit first in the US. And so we had crazy numbers. And basically the American Academy of Ophthalmology, our kind of organization that most ophthalmologists belong to, they mandated that we all close our practices, completely close our practices for an indefinite amount of time. And that was because many reasons. Number one, there wasn't PPE available. We didn't have the protection that we needed. And then also the protection that was out there was in limited supply. So it needed to go to the hospitals, the ICUs, et cetera. So they didn't want us to use up resources. And then of course we couldn't do surgery. So that was all stopped because the ORs were being used, were reserved in case they needed like overflow ICU beds. So everything was shut down for 2.5 months. So basically I had to close my practice for 2.5 months. I did some telemedicine, but it's hard to do telemedicine with eyes because we need to examine the patient. And then gradually kind of things started to build up again. And now I would say I'm pretty much back to pre-pandemic numbers in terms of my volume. But of course, we have to take all the precautions. So, I'm wearing all my protective equipment, my N95, my eye protection, et cetera. My staff wears it. The patients wear their masks. We have other things in the office to protect, because in ophthalmology, we get very close to our patients. Our faces are pretty close to the patient to examine them. So we have other protective kind of plexiglass protective equipment that we use. And then, of course, we do screening. So all of that has really kind of changed the way we practice day to day, but it's all for patient safety and staff safety and doctor safety. So I think most people understand that and they comply with all of that.
Absolutely. So this is also another one of those interesting questions. What is a stereotype about physicians in your specialty? Have you ever come across any stereotype?
Yeah, I think, well, two kinds of stereotypes. One is that ophthalmologists are very type A and almost OCD because we have to pay a lot of attention to detail. And I would say, yes, most of my colleagues and myself are probably more type A, very, I don't want to say perfectionist, but really a lot of attention to detail and being precise. It's, when we operate, we have to be precise because it's all microsurgery that we do. So that is important. The other stereotype is, and I've heard this from other doctors, is that ophthalmologists don't work that hard. That is not true. Yes, we do have outpatient clinics where we can have like a set day, like 9 to 5 or whatever. We set it at 8 to 4, 10 to 6, whatever it is. But it doesn't mean that, our workload is any less than any other specialty. It's actually, we see quite a few patients, many of us. And the complexity is, at least for what I do as a neuro-ophthalmologist, my patients are very, very complex. They require a lot of, even after their visit is over, I really spend a lot of time coordinating their care. So I have to call other doctors. I work with other doctors in other fields like primary care, rheumatology, neuroradiology, neurology. So there's a lot of coordination that goes on. There's a lot of testing that I order that I have to review. So it's not just, seeing the patient in the office for a couple of minutes and then, sending them on their way. You really have to follow up. So it's much more intensive than I think a lot of other specialties may think.
That was an interesting take on it. So without any patient privacy violations, of course, what is the most rare case that you've ever encountered in your practice, and as general of a manner as possible?
There's so many rare cases. I mean, that's kind of the nature of what I do, is I see very rare things. And, if I don't know how you found me, but, I on my social media, I do post a lot of the interesting cases. So if you're ever interested in neuro-ophthalmology, follow me on my social media on Instagram at dr.ronnie.banik. But I see a tremendous amount of rare, sometimes even bizarre presentations. The one that I can remember that was really, that really stands out is a baby who had come in. This baby was 3 months old, and the baby had a droopy eyelid, and her eye was kind of not straight. It was kind of deviating outwards. We call it like lazy. The lay term is lazy eye, but there's a proper term for that called strabismus. Anyway, she also had, when I was examining her, she also had findings in her retina. And the retina doctor didn't know what they were. And it turned out that she had a very rare case of trilateral retinoblastoma, which is a type of tumor. And so she had tumors in both eyes, but also in her brain. And this was diagnosed actually in utero. So even when she was, her mom was pregnant, they'd done ultrasounds and they found, oh, there's something going on in the brain. So she had a tumor in the brain, tumors in both eyes, a very rare kind of aggressive type of childhood cancer. So yeah, that case was quite sad, I would say.
So here's another question that's based off a common stereotype about all doctors in general. They say it's very hard to maintain a work-life balance because you spend so much time, not just I think in the office, but also out, thinking about patients and their cases. So how do you maintain a work-life balance in your field of medicine?
So that is a work in progress. It's not something that, you can set in stone. It's always changing. But, I would say a few years ago, I was working a lot. I was teaching, I was seeing patients, I was operating, and it really became overwhelming. I was doing research. It really became overwhelming. So I had to cut back. So I completely changed I actually left. I was in an academic position, like a full-time academic position. I left that position to open up a private practice. And that allowed me to set my own schedule, to be more flexible. And, I have a family, I have a daughter, to be able to, be there for her for school, whatever she needed. And still see patients, but it was on my own terms. I set, how many days a week do I work? How much do I work? How many patients do I see? And I still maintain an academic affiliation. So I'm still associate professor of ophthalmology at the medical school. And that still allows me to teach and still allows me to do research. So I enjoy that. But I also, in my private practice, I can have more control. So I think at some point, if some type of practice is not working for you, like for example, I used to be full-time academics, and I thought that's how I was going to be until I retired, but things changed and I made a switch. And initially it may be frightening to try to make a switch like that, to go from academics to private practice or vice versa, but or even a group practice. But you have to do what's right for you, for your lifestyle, for your mental health, for your physical health, for your family. So it's really, things change all the time. So don't be afraid to, it may be scary, but don't be afraid to do what you think is best for your own well-being.
So the next question is, what is the most common procedure and condition that you encounter in your day-to-day practice?
I would say cataracts. Cataracts are probably the most common. A cataract is a cloudy lens inside the eye. And normally the lens is clear, but then as we get older, or if there's other things like steroid use or trauma or radiation injury, that the lens can become cloudy. And basically it affects the amount of light getting into the eye. So people can't see clearly. They may not be able to see far away or up close, and it really impacts their function because it's like looking through a dirty window. Like imagine that you have this kind of opacity in front of you all the time. So in cataract surgery, we take that out. We take out the I'm not saying dirty lens, but cloudy lens, and we replace it with a clear implant. And it's probably one of the most common procedures done in the world, and it can restore patients' vision. As long as the rest of their eye is healthy, it can restore them back to 20/20. It's very rewarding for patients because then they get their life back. They can get back to doing what they used to do, like working again or driving again or being able to read or use a device. And for doctors, it's very rewarding as well to be able to have that kind of a positive impact on someone's life is really a wonderful thing. So I love cataract surgery. Yeah. And so I would say that's probably the most common and most rewarding procedure that I do.
So all of this brings us down to the final question, which is, what is your advice to students like me who wish to go into medicine, or those who are currently in any stage of becoming doctors?
I would say, well, first of all, I congratulate you in your interest. I mean, it's wonderful that you have this interest and you're looking to pursue it. I would say try to expose yourself to medical fields as much as possible. I know it may be difficult if you don't have like a personal connection, if you don't have a family member or a friend or someone in your community you can follow, but really have to seek out those opportunities and really see if it's for you, because some people may think, oh, I want to be a doctor and it's this type of lifestyle. And then when you actually start doing it, it may not be what you imagined it to be. So before you pursue that route, really kind of try to get exposure, try to get some shadowing opportunities, maybe even research if it's possible to do some chart. I know it's hard now with the pandemic, but to do some kind of chart review or even like a basic science project, and then explore it and see if it's really for you. And even once you even go into medical school and once you even graduate, there are many different types of medicine people can practice. So it's not just about seeing patients. It's about healthcare in general. So some people become research scientists. Some people become hospital administrators. Some doctors become advocates in the community. So there's so many different other things, or they may even work for a pharmaceutical company and be a research like a lead for a clinical trial. So there's so many different opportunities out there in medicine. It's not only patient care. So keep that in mind also as you're exploring, what's available to you.
So this has been an absolutely fascinating conversation. Thank you so much for joining me and for giving your time. If you could just hold back for one quick minute after I stop the recording.